The following program is a Greenlight Maine production being brought to you in part by Bangor Savings Bank.
It's the way life should be. Greenlight Maine, building Maine's economy. Greenlight Maine, start here, scale here, stay here. It's your Maine and mine, building Maine's economy, one dream at a time. It's the way life should be. Greenlight Maine.
Welcome to Greenlight Maine. We have 10 of the most talked about startups in the state and a prize purse worth $40,000. Today's matchups will be advancing our healthcare system. We also have some judges who have a lot of experience with a lot of different things, and we're going to meet them first before we begin. Welcome, David Pease from Bangor Savings Bank.
Hi, how are you? Yes, I'm David Pease. I'm the Director of Talent and Diversity for Bangor Savings Bank, and my job is to really work on the Maine workforce and ensuring that we are a welcoming and inclusive state.
Very important. Next up, we have Katie Shorey from Live and Work in Maine and Startup Maine.
So with Startup Maine, we are the convener and the champion of the entrepreneurial ecosystem in Maine. We bring together resources, host events. We just really want to lift up all the great things that are going on in the state. And then Live and Work in Maine, we are focused on talent attraction and retention, trying to let everyone know the great career opportunities that we have in state.
We're very happy to have you. And rounding out our panel today is Tom Raffio from Northeast Delta Dental.
Thank you. I'm so happy to be here, and I've been CEO of Northeast Delta Dental, which includes Maine, New Hampshire, and Vermont dental health, and this is relevant for today's topic. And I'm looking forward to hearing some great stories today.
Another perfect judge. Okay, we're going to talk to you in just a couple minutes. Our first pitch is called Radiolife, very interesting. And I'd like to welcome Sergio Ribeiro, whenever you're ready.
Thank you. Hi, I'm Sergio, founder of Radiolife, an early-stage biotech startup focused on reshaping the future of diagnostics. Current diagnostic methods are expensive and require complex infrastructure, as well as highly skilled operators. And that means they are susceptible to human errors. Also, only 1% of global primary care clinics have basic diagnostic capacity, according to the World Health Organization. And that means longer patient journeys, right, as well as inadequate patient outcomes. Our solution is a platform capable of testing various liquid samples like saliva and urine. And inside the device, a biosensor measures radio frequency patterns in under 20 seconds with zero need for reagents, resulting in a swift patient experience, more efficiency for laboratories, and more environmental friendly solution. Every pathogen and biomarker has a unique molecular signature. When we scan a liquid sample using RF, we are creating a distinctive fingerprint, and then we use AI to match those patterns with our catalog stored in our cloud database. On a preliminary study, our model achieved 99.77% accuracy when compared with the RT-PCR gold standard. Then we received our patent grant and went through an acceleration program here in Maine at the Rue Institute. And with all the support we received from Maine, including a grant award from MTI, Maine Technology Institute, as well as a partnership with Maine Health's Nordex, we decided to establish and register our business here in the state and grow from Maine to the rest of the country and hopefully to other countries in the future. So our next big challenge is to expand our catalog, enhancing our product and platform's capabilities, and bringing our solution one step closer to regulatory approval. We are already doing so here in Maine with an initial focus on E. coli detection, which is a segment estimated to hit $3 billion by 2030. So we plan to take our winnings from Greenlight Maine to help us publishing our preliminary studies, accelerating our FDA clearance, and consolidating our presence here in the state. So thank you very much for the opportunity, and I'm happy to take your questions.
Well, that's what we want, positive patient outcomes. So thank you so much.
Thank you.
Okay, David, kick us off.
Terrific new sort of product. So how long will the FDA process take?
Yeah, so we estimate from 12 to 18 months process. Our regulatory strategy is to first try to get the FDA breakthrough designation and then work closely with the agency to run through the clinical trials.
Great.
Katie.
How are you finding some trial customers, and what does it look like with building some other of those partnerships on the ground as you're trying to also make money? What are you going after there?
Yeah, so part of our strategy is once we're getting ready to go through clinical trials is to find the right partners called CROs to support us through the clinical trials process. And they already know, how to select the populations, the best way to make sure that we have a smooth clinical trial process.
Tom.
Well, first, thank you for trying to improve population health. I mean, that's what it's all about, so thank you. So I know you're in the middle of the regulatory approval, and building on this question, how are you going to start marketing it, though, to clinics, hospitals? Because obviously they get a lot of feedback from different other companies with the latest techniques. So how are you going to differentiate yourself?
Yeah, that's a great question. So our go-to-market strategy, we are going to first partner with strategic laboratories. For example, here in Maine, we are already working closely with Nordex from Maine Health. And we hope that as we get regulatory approval, we're going to introduce other laboratories across the country to make sure that we are able to escalate our operations.
Thank you.
David.
Why are you passionate about this work? Why did you create this company?
Yeah, so I'm not a doctor, I'm a computer scientist, and I love challenges. I love making things that can cause a positive impact in the world. And I have the background necessary for conducting the machine learning, artificial intelligence part of the technology, and then it brought the team together to make sure that we have all the skills necessary to go until the market and regulatory approval. But I think working with something that you're passionate about, that you love, and knowing that it can cause a positive impact on people's lives, for me, is the big aspect of it.
Nice. Katie.
Tell me what goal number you need to raise, or a goal number that you're going after, and then also just very curious about the advisors that you have circling you.
Sure. So in terms of fundraising, we are aiming for $3 million. And from 2/3 of those funds, we are focused on private investors. And the other part is going to come from non-dilutive grants that we are focused on it right now. We already got the grant from MTI, and we are working with NSF and other agencies as well. And that's the number that we need to be able to get through the clinical trials and start selling. In terms of the advisors, you asked, we have our Chief Scientific Officer has over 30 years of experience in immunoregulation of infectious diseases. Dr. Rodrigo, he's a microbiologist. Our regulatory compliance advisor, Michelle McGuinness, she has over 20 years of experience working with regulatory compliance and worked with companies like Johnson & Johnson, AstraZeneca. And we have other mentors that came when we participated at the Rue Institute program that also supports us in the process.
Well, you are well on your way, and we can't wait to see what you do. So congratulations. We need to take a short break and hear from our sponsors, but don't go away because a lot more Greenlight Maine is coming up next.
At Bangor Savings Bank, we understand that to deliver the best banking experience possible, meeting people where they are matters. That's how we fulfill our fundamental promise that you matter more. We are more than just a bank. We are friends, neighbors, and tireless advocates for the communities we serve. Wherever our customers are in their financial journey, we are there with them every step of the way.
right into the lens, okay? Famous brands, rugged quality, and the best values anywhere.
This is where you start your future, where you find the skills you need to succeed and the support to help you on the way, where you will find the power of innovation and creativity and the challenges to help you grow. Find a beautiful environment and a community that inspires, where you can turn your passion into your profession. This is where you start your life. This is where you belong. Thomas College.
Whether you're a small business or a big business, whether you're cutting edge or looking at a traditional industry in a whole new way, whether you're on the coast, in the city, a small town, wherever. If you're an organization here in Maine, if you want to innovate, and if you want to grow, we want to support you. We're the Maine Technology Institute.
Welcome back to Greenlight Maine. We have another game changer in the healthcare space. I'd like to welcome Bronwyn Bridges from PragmaClin. Whenever you're ready.
Thank you. Hi there, my name is Bronwyn Bridges and I am the CEO and co-founder of PragmaClin. Now before I tell you where PragmaClin is today, I'd like to introduce you to Gord. He was an avid runner his entire life, until his 50s where he notices gait and slowness occurring. He brushes it off as age-related symptoms, as sadly many people do to avoid the emergency room. Until a few years later, he starts to notice he's having trouble with his balance and having trouble shaving in the morning. When he finally goes to seek help, he is told it could be a 1 to 2 year wait time to see a neurologist. This wait time now exceeds up to 4 years in some rural populations. Gord now is one of the 10 million people who have been subjectively diagnosed with Parkinson's disease and is only seen once a year for follow-up. Like many others, he also does not have access to a movement disorder specialist, meaning he receives less than optimal care. So we wanted to be able to tackle the rural and remote issue, but also the clinical efficiency to reduce those wait times. So at PragmaClin, we created PRIMS. PRIMS is a clinical decision support tool that is able to provide real-time motion capture assessments from within the clinic. We do this by utilizing existing hardware and software we've created that can capture all of the motor symptom progressions for Parkinson's patients. From doing this, we can then show comprehensive, accessible data and notifications for clinicians, patients, and other stakeholders. We use internationally recognized scales so that we're actually able to monetize and help the clinics and hospitals have a revenue-generating source while also increasing the access for patients. But we didn't want to stop there, so we also created an application that can then track weekly surveys for patients and caregivers. From home, they can complete these for better self-management of their disease and be able to have a better continuous care circle as a whole. So from here, we've been able to then create and capture partnerships from across the globe with neurologists and movement disorder specialists everywhere. From this, we are planning to sell from a B2B SaaS subscription model on patient tiers. We fall under existing reimbursement codes in the healthcare system, allowing them to monetize on this as well, improve the efficiency, and tackle the rural and remote problems, which is why we're here in Maine. And we've partnered with Maine Health, as well as being a founder at the Rue Institute in their residency program. We've been able to create these partnerships to grow traction. We've managed to leverage over $2 million in non-dilutive government funding to develop our MVP and scale at our team, create those global partnerships, and hopefully continue to scale. We've brought in mentors and advisors that are helping us to get there. And now our next step is to secure more funding to help us get through our validation trials with the FDA, gain clearance, and start a commercial process. So we're looking for clinical partners as well as funding opportunities and access to those patient populations so that we can help more people receive better care quicker. So welcome to PragmaClin, where the future of movement care starts at home. Thank you.
Nice pitch. This is really transformational. I can't imagine just how many people you're going to help with this. Okay, David.
So how many patients are you currently working with, and what's the possibilities? How many Parkinson patients are there?
Yeah, so currently there's 10 million, as I said, across the globe, but that number continues to double every 20 years because of the aging population. So far in clinic and clinical practice with neurologists, we've assessed 44 patients. We've had great success and accuracy of up to 95% on our algorithms, which currently right now with 25% misdiagnosis, I'd say we're doing pretty good in comparison to current clinical healthcare. With our Maine Health partnerships here, we're actually looking to seek another 40 patients here within the urban centers, and that will help us to grow and scale. But we have some of the world-renowned leaders from King's College in the UK, University of Cork, and a couple other partnerships in the US and Canada. So our presence is growing rapidly, and we're hoping to be able to tackle a large portion of that. But one piece in scalability that we also have is in movement disorders, we can then tackle MS, stroke, Huntington's, and other diseases that use a lot of the same scales and motor captures as well.
Awesome. Katie.
I was going to ask about the other diseases. So just curious, the biggest challenge of getting in front of hospitals, what's there?
Knowing the right people is definitely a piece of the pie. So you really need to find a clinical champion. We've done a lot of great work because my background is actually a PhD pharmacology researcher who I'm still currently enrolled in my PhD while I'm doing this. And so I've been able to leverage a lot of my academic side to attend conferences and present posters on behalf of the company and myself, which has been a nice kind of leeway into the pathway. But it's also allowed me to get in front of a lot of neurologists. And once we found one clinical champion, which was actually King's College, that name kind of then passed across the board and has since opened up a lot of doors to movement disorder specialists worldwide. And now we're in several states across the US talking about conversations for trials. So I think once you get in there and you can show the value proposition, it definitely helps to open up a lot of those windows. And people who believe in technology being the way forward is definitely helpful.
Tom.
Hey, thank you for being a game changer for Parkinson's. I'm sure that it's so meaningful. So you mentioned that you have the codes that will be reimbursed, which I think is a real positive, and you're partnering with clinical partners and neurologists. Have you gotten testimonials from neurologists?
We have, yeah. So I think testimonials really started when we started working with King's College. A lot of them saying it will help to optimize their current treatment strategies and provide that better end-to-end care. They recognize they don't have the time and the capacity to see patients as frequently as they would like to, but they also know that the data that is currently provided by some other companies in the space that provide us a better clinical and competitive advantage is actually that we can provide concise data that allows it to be billable without taking a lot of the clinical practice time. And when we did our clinical data collection at King's College Dubai, one of the testimonials that we got was how well it fit into the current clinical practice, which is one of the largest pain points of why tech is currently not adopted into a lot of the hospital settings. So it was actually shorter than their current assessment time. It took 11 minutes start to finish to do our entire assessment, and they were impressed that it didn't impede in that practice for them. So I think getting testimonials like that have really helped us to get a lot of traction from those key opinion leaders.
Great, thank you.
Thank you.
Well, speaking of traction, you are well on your way, so congratulations on everything so far.
Thank you so much.
All right, we have to take a short break. When we come back, our judges are going to talk this out, so don't go anyway. We'll be right back. Come on over.
With so many Medicare options, it can be confusing. At Martin's Point, we make your Medicare choices easy. Our all-in-one Medicare plans cover doctor's visits, hospital stays, and prescription drugs, dental, vision, and eyewear, fitness and wellness reimbursements, with premiums and copays as low as $0. As one of the highest-rated Medicare Advantage plans in New England, you can feel confident you're covered. Call or visit us online today to request your free Medicare Made Simple guide.
I am truly awestruck by the innovation that exists.
Fame has fundamentally been a part of keeping the business community here resilient and robust.
Our role is to help.
Come on in. To have people in your corner that will guide you through the whole process is really helpful.
When they say, hey, we believe in this, it's a real boost to confidence.
Fame works for Maine, helping businesses and lenders create a bright economic future.
It's about helping Maine grow.
Whether you're growing your audience or your network in person or online, it's important to make people feel good. It's important to make people feel like they want to come back for more and ultimately to continue referring you to others. In today's world, networking happens both in person and online. You need to do both in-person and online networking to build your personal brand. I believe that if you meet someone online and you find that person interesting, you should figure out a way to meet up in person. And if you meet in person, you should connect online to extend the relationship. The more people you're connected to, the stronger your network, and the more opportunities you'll have to do business and to do good things for your community and the world.
Welcome back to Greenlight Maine. Our judges get to spend some time off camera to get to know these companies and take a deeper dive. And now we're going to hear what they have to say. Katie, let's start with you, and let's start with Radiolife, only because Sergio pitched first.
Yeah, I mean, I think it is such a compelling technology and a product, and I'll just be super curious how they'll stay ahead with the changing tech and just having a physical thing that they need to build. But it sounds like he is committed to Maine, and they have a ton of partners here, which will help them scale. So I have high hopes for them.
Mm-hmm. It was impressive that he moved here from California and said that he has never received any support like he has had in Maine. So great job to the state of Maine for helping him.
It's great testimony to Maine for sure. Yeah, I mean, he's going to make a big difference in life. The only challenge, I think, is going to be that regulatory approval. Being in the healthcare industry myself, I know that even the most optimal new technologies takes a while for approvals, and there's a lot of, for lack of a better term, politics involved with it too. So I hope he stays the course, because that may be the only challenge ahead.
Yeah, it takes time with the FDA for sure. David.
Yeah, it's so refreshing, right? To see the innovation, to see the partnerships happening, with startups here with so many of our organizations. So that's really great news. A great technology, super exciting, but as Tom said, the FDA waiting on the trials, how do you maintain a company? How do you continue to get funding when you still haven't gotten approval? So I think it really is about staying the course and him staying really focused and believing in his work.
And that he is. Yep. Okay, let's switch gears now to PragmaClin. Bronwyn has done a ton of work, a lot of research. She's a PhD. She's got it going on.
What great energy, and just clearly has a vision for and identified the need. I mean, it started with a personal story, which is great. I would be curious just to know a bit more about how they are navigating that clinical space, how she and the team plans to stand out. I mean, we actually didn't touch on competitors, so I'll be curious just to see. I mean, I know that they have opportunities to move in the spaces of MS and other diagnostics, so I think just hearing how she plans to stay ahead of the curve will be what we need.
Yeah, it's nice that she can help so many other disease states with this tool as well. Tom.
Yeah, Bronwyn already checked off many boxes, including making sure that it will be reimbursable, which, being in insurance, that's, I think, the reality of the healthcare system. But I think, again, the same challenge of the approvals, the regulatory, because this is so needed in the Parkinson's world, and then ultimately other diseases as well. But there's still such a long-term process for the approvals, but it sounds like she's doing all the right things and getting the testimonials from neurologists and patients. So I think she's got a great opportunity and certainly has a passion for this and Maine.
Mm-hmm. Yeah, the partnership with Maine Health and Northern Light is key. I mean, and she talked about how she has to be in a rural state, so she definitely has that going for her here.
Yeah, I mean, Maine is going to benefit from this product, right? I mean, we are a rural state. Healthcare and access to healthcare is really difficult for folks living in remote rural areas. So this is part of the solution. So again, great innovation, great partnership, and incredible energy. I think it's already been said. Again, the trials, it just takes time. So, but this is really focused. I mean, I think this, she's done a lot of the really great headwind. So it's just if she can get that FDA approval, I think this is going to go far.
Okay. Let's just do some closing thoughts just on both companies real quick. We got about a minute left. Katie.
I want to know how they're going to, it must just be so competitive and just a busy space. So really trying to learn a bit more about not only how they can differentiate, how they're going to scale up the teams. Do they need to build partnerships outside of Maine? How can they make sure they can stay in Maine? I think that the idea that they can be highly scalable is great, and I would love to see them stay here. So.
Absolutely. Tom?
Yeah, so I think the main thing is, will they keep their energy level? I mean, they have this fabulous technology, it's relevant to healthcare, population health, but it's going to take a while. So the management team, the advisors, one thing I would ask again is, how are they going to keep their energy over the next 5 years until they start seeing the return?
The team is so important, right?
Exactly.
David?
Well, I think in our current system, clearly the waiting periods to see a healthcare provider, the many steps before you can even get diagnosed, and again, waiting. So this is the technology. We need this technology to help enhance and improve our healthcare status. So we all need to support them as they are waiting trial.
Excellent. Well, we appreciate all your feedback. You were so helpful to them. And now we're going to give you 1 more minute to decide. And please don't go away, because when we come back, we'll tell you who gets the green light. We'll be right back after a word from our sponsors.
Albin, Randall, and Bennett, committed to providing accounting solutions to Greenlight Maine startups, working with businesses and organizations that operate locally and nationally. ARBCPA.com.
Whether you're a small business or a big business, whether you're cutting edge or looking at a traditional industry in a whole new way, whether you're on the coast, in the city, a small town, wherever. If you're an organization here in Maine, if you want to innovate, and if you want to grow, we want to support you. We're the Maine Technology Institute.
Welcome back to Greenlight Maine. Our judges have had some time to deliberate, and it's time to find out who gets the green light. Judges, I'm going to count you down. 3, 2, 1. And that means PragmaClin is today's winner. Congratulations to Bronwyn. You are moving on in the competition. Well, that's all the time that we have for today. Thank you so much for joining us. And if you would like more information on the show, please check out greenlightmaine.com, where you can find all of the episodes, and please give us a like on our social media. We'll be back next week with 2 more inspiring companies, so please join us then. Have a safe and successful week. Congratulations. Well done. Yes, come on over. Yeah.
Greenlight Maine would like to thank our premier partner, Bangor Savings Bank, our corporate partners, and our sponsors. Thank you.